Hello and welcome. Today, we're going to peel back the layers on bipolar disorder. We'll be taking a clear, clinical look at what this condition is, a condition really defined by these significant shifts in mood, from the incredible highs of mania all the way to the lows of depression. So, here's our game plan for this explainer. We're going to build our understanding across 5 key areas. First, we'll talk about what separates a mood disorder from just, everyday feelings. Then, we'll define what a manic episode actually is. After that, we'll explore the different types of the disorder, look at treatment pathways, and finally, we'll wrap it all up by summarizing the key distinctions. So, first things first, let's set the stage. It is absolutely crucial to understand the difference between the normal emotional roller coaster we all ride and what makes something a clinical mood disorder. Look, we all have good days and bad days, right? Feeling sad when things are tough or feeling joyful when something great happens. That's not just normal, it's a healthy, fundamental part of being human.
This brings us to the big question. Where's the line? When does a perfectly normal feeling cross over and become a clinical symptom?
Well, it really boils down to 2 things, intensity and persistence. A mood disorder isn't so much about what you're feeling, but about how prolonged and excessive that feeling is, whether it's sadness or joy, and all the other specific symptoms that tag along with it.
Okay, so now we're going to zoom in on the one thing that really sets bipolar disorder apart from other mood disorders like unipolar depression, and that is the manic episode.
So what exactly is a manic episode from a clinical standpoint? Well, we're talking about a very distinct period. It has to last for at least 1 full week, where someone's mood is persistently and abnormally high, expansive, or even really irritable. And when you look at the symptoms, you can almost feel that overwhelming energy. We're talking about this inflated sense of self, almost like you're invincible. A dramatically decreased need for sleep, being way more talkative than usual. Your thoughts are just racing. It's like the brain is just firing on all cylinders. And this actually makes a lot of sense chemically. We see a strong link to high levels of norepinephrine, which is a neurotransmitter that basically gets the brain all revved up for action.
But here's a really key point. Not all ups are created equal. The intensity of that elevated mood is actually what helps clinicians figure out which type of bipolar disorder they're looking at.
Yeah, the diagnosis really hinges on just how severe those manic symptoms get. And there's this fascinating theory called the permissive hypothesis that tries to explain why these swings happen. The idea is that low levels of the neurotransmitter serotonin kind of open the door, making a person vulnerable to a mood swing. Then it's the level of norepinephrine that decides the direction. High levels push you towards mania, while low levels lead to depression.
And that brings us to a new term, hypomania. You can think of it as a less intense version of mania. You still have that elevated mood and extra energy, but it's not so extreme that it seriously messes up your life or gets you hospitalized.
Okay, so this chart lays it all out perfectly. For bipolar I, the defining feature is having at least 1 full-blown manic episode. The highs are really, really high, causing major disruption. With bipolar II, on the other hand, you see a pattern of those less severe hypomanic episodes. But, and this is super important, to get a bipolar II diagnosis, you also have to have experienced at least 1 major depressive episode.
All right, so we've got a handle on the diagnosis. What's next? Let's talk about the pathways to managing the condition and finding some stability.
There's no single magic bullet here. Achieving balance really requires a multifaceted approach. Effective long-term management almost always combines medication to address the underlying neurochemistry with therapeutic strategies to manage daily life. So you've got these 2 main pillars, medication and psychotherapy. Medication, like mood stabilizers, helps manage the biological side of things. Then, psychotherapy provides support and crucial tools. A really interesting type of therapy is called interpersonal and social rhythm therapy, or IPSRT. It focuses specifically on stabilizing daily routines, like sleep schedules and social interactions, because big disruptions in these rhythms can actually trigger a mood episode. When we talk about medication, we have to talk about lithium. It's been a cornerstone treatment for decades. It's really just a simple chemical salt, but it is highly effective. Now, while we don't know the exact mechanism, it's believed to work by stabilizing how sodium ions travel across nerve cell membranes, which helps regulate the firing of neurons and prevents those extremes of mania and depression. Anticonvulsant drugs are also sometimes used as an alternative.
But let's be clear, medication alone is rarely enough. Therapy is an absolutely crucial partner.
It helps individuals and their families understand the disorder, identify triggers, and develop a whole toolbox of strategies for navigating the day-to-day challenges of the condition.
Okay, let's bring it all home. To make sure everything we've covered is crystal clear, let's put these conditions into a simple, side-by-side framework.
This table just lays it out so clearly, right? On one end, you've got unipolar depression, that's all lows, no highs. In the middle, there's bipolar 2 with its pattern of major depression, plus those less severe highs of hypomania. And then all the way on the other end is bipolar 1, which is defined by the presence of severe, full-blown mania.
And this leaves us with a final thought to chew on. We've gone through the clinical definitions, the symptoms, the chemistry, but the real takeaway is this. How can taking the time to truly understand these conditions help us move beyond the labels, to foster greater empathy, reduce stigma, and build better systems of support for everyone affected?